Now, 12-year-old Nigerian boy Adebola had been battling to survive after multiple surgeries were performed on him, and it was confirmed that his small intestine was missing. Now, you want to ask, in what world does that happen? Well, the story gets even more sad after the young man lost his life, and it was alleged that the doctor who operated on the boy, not once but twice, is in fact not a qualified surgeon. But then investigations are still ongoing as to whether or not the doctor who operated was qualified. But even the doctors are not exempted from this case of negligence, because another case in point is the heartbreaking event that occurred at General Hospital Odon in Lagos in August, when Dr. Ware Diaso, a medical doctor and a house officer, became a victim of an elevator accident where she was trapped and eventually lost her life. So we see systemic failures, malfunctioning laws, and ill-equipped workplace for these doctors at play. And, one will ask, what exactly is going on in the health sectors? Are the patients safe? Are the doctors in good care? That is what we'll be talking about now. And joining me to have this conversation is Dr. Benjamin Olowojebutu, the chairman, Nigerian Medical Association, Lagos. Dr. Benjamin, thank you for joining us on the show.
How are you doing today?
All right, you're welcome. Dr. Benjamin, I think we're going to start with a very obvious question. What is going on in the health sector?
So I think that there are several issues going on. Number one is there's reduced budgeting for healthcare in the country, and it transcends every sphere of the state and the local government, and also there is issue of brain drain in the country, again affecting the workforce of this country, medical doctors, allied medical alike. So the health sector in this country is very, 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 very strained right now, and all this is affecting the outcome of healthcare in this country. So for me, it's important we address and have a state of emergency for healthcare in this country. All of us can sit down and we need to analyze how we want our lives to be and how we want our healthcare system to be going forward. Because right now, it's going to get worse because many doctors are still leaving, many nurses are still leaving, many pharmacists are still leaving the country. And the WHO rule of having one doctor to 6,000 patients will never work. Right now, we have one doctor to about 95,000 patients in this country. So there's a burdensome of the workforce of this country right now. So it's multifactorial. We need to be accountable. We need to ask right questions. Are the budget for the healthcare that we have right now, are they going to the right places? Who is monitoring them? Who is evaluating them? Who is making the impact on the population affected? How is that affecting our GDP, our workforce in this nation? Are we creating that atmosphere for our colleagues, our citizens to seek healthcare in our institutions? Are the politicians themselves using the healthcare in this country? And are they seeing what's happening in the country? Are they pumping in money and pumping in policy to those things? Because, you hear that a politician is sick and immediately they get out of the country using taxpayers' money to seek healthcare somewhere else, whereas our own country, we're not fixing it. So for me, it's multifactorial blessing.
And patients now. Now, in the case of Adebola, the 12-year-old boy, now there are claims that the doctor that operated on him was not qualified, but we're not going to go into the details. But the question here is it even possible that an unqualified person is allowed to perform surgical procedure on a patient? What is the process? How do you scrutinize the doctors who are on duty? How do you know that the people there are qualified?
So we have discussions and meetings on that particular aspect today, and I can give you clarification by tomorrow. But right now, I'm not allowed to speak on those issues until I get feedback from the two organizations that are involved in the management of this boy.
That's fine, Mr. Benjamin. But the question here is there a possibility at all that someone who is, have we had that kind of incidents before as precedents where someone performs a surgical operation on a patient that wasn't qualified?
That's a true statement. So we have to inform the public properly after the meeting we have this evening. So But a doctor, a non-doctor performing the surgery, I don't think that is very correct. So let's not give misinformation to the public.
Okay, that's fine. Now, let's talk about ill-equipped facilities. Why exactly is nothing being done about it? I mean, in the case of the doctor who sadly passed away after being trapped in an elevator, they claimed, that's the doctors there, her colleagues, claimed that they had complained severally to the government and those in charge about their facilities, especially that particular elevator that wasn't working for a long time, but nothing was done about it. What is the medical body doing to make sure that the government prioritizes that sector?
Yeah, blessing. We have written letters. We had a report. We had an independent panel that had NBA part of the lawyers and also engineers that looked at it critically. The report is out, and we are sending a report to the government and the Attorney General of Police to set up a coroner inquest on this case. But one thing I want to challenge you guys in the media space is the kind of attention you put to our cases. I think it's important going forward. I commiserate with the families of Mohbad and also his wife and kid and also the parents. The kind of attention the media has given to Mohbad's death and the kind of attention that made the government immediately respond to that is what is giving that Mohbad's death some kind of attention now. But I don't see the media helping us also gravitate and gravitas what is important in this space. I think you guys are kind of selective because the way you reported the case of Mohbad and everybody's talking about it. If you have helped us talk about this case of this gruesome murder of our colleague in the hospital that she works, and we can get the attention of God, because obviously it looks as if they want to make it like business as usual. Nobody's accountable. Nobody's coming to say we're sorry about what happened there. We've had complaints over many years, but we're unable to fix it. This is what the problem is. We're sorry. You're coming back to fix the problem, and we're sorry. And nobody's going to jail for it. Nobody's going because it's criminal negligence, and nobody's talking about it. So I have come today to beg you guys to also speak in the audience of media work. Help us also make noise about what is happening towards in healthcare. I realize that government also always listens to what's happening in the media. When you compartmentalize it, because one, that is one doctor that will have been saving 8,000 patients in this country. Gone. And no respite. We have said that the first we have said to a coroner's inquest, he will name the building, name that doctor's quarters after to at least to immortalize her name. Nobody is doing anything. Nothing. It's sad. It's painful. Why wouldn't there be brain drain? Because obviously the doctors feel that the government that they work for passionately don't care about them. So why are they staying in the country? Why are they staying in this country? So people want to go to school, want to give their life, want to give their life to humanity, want to help the country, but they're not getting commensurate value from government in this country. We need your help, media. You guys need to help us compartmentalize this problem so we can begin to solve it one after the other. People that are accountable, that are culpable to the death of our colleagues should come out and they should be prosecuted. We should see them, name their names, and let them be prosecuted. Is important so that it will form a deterrent. People that are leaders, that are leaders, to take their job more responsible and accountable.
All right. I'll tell you what, Dr. Benjamin. Now, we're having a program where we're talking about how doctors have, for the longest time, lamented ill-equipped facilities, and you helping us understand how much of a burden it is. Telling the media is one way to solve the problem. So, if you ask me, I would say that the media is doing their job. Now, we project what the concerns of the people are, including the concerns of the doctors, and that's why we're having this show. So, that is why we're asking, what exactly is the medical body doing? What have there been protests? Have there been complaints to the government regarding the ill-equipped facilities? When we talk about these things, the government is held accountable for things that they should be doing, and the people also know what's happening. Do you get that, Dr. Benjamin?
Well, what I think is important is that the political will to solve health problems in this country is dwindling, because most of the upper class, middle class, and people that are in government positions, they have access to healthcare somewhere else. But if we now mandate and have a policy-driven document that says all the politicians, all the upper class people in this country, when you get into the office, your first 2-3 years, use facilities that are in this country as your primary healthcare provider. I think we'll start having proper intervention in healthcare. Number two is that there must be conscious effort of trying to get people in the rural communities to get healthcare. What is happening in Lagos basically is that there's population explosion. Every day people are coming into Lagos from rural communities because they want a better life, they want better amenities, better joy. But the facilities in Lagos cannot take care of everybody in Lagos. So there'll be inadequacies for human capital. There'll be inadequacies for the services. There'll be a long queue to access the patient. So it's important government begin to build more facilities and have what we call public-private partnership that will make people see that healthcare is not just capital. It's not a social capital. It's also an investment. I'm having people coming to invest in healthcare and solving some problem, demand problem, supply problem, service problem. So we are all building the healthcare together, and all of us as individuals will start patronizing our own healthcare in this country and not spending our money as medical tourism to other countries. So we start putting our mouth where our money where our mouth is basically. And importantly, government should increase the budget to 15%. That is Abuja Declaration 2021. It's important that government should focus, because if the nation is not healthy, we cannot be wealthy as a nation. It's important we look at it clearly and have what we call an accountability regime. So people in local government are accountable to state government and state government are accountable to, so people are monitored properly. You don't just put funds into healthcare and they're not monitored. It's important to do that going forward in this country. Thank you, Blessing, for listening to me.
Dr. Benjamin, thank you so much. You really have touched on salient points, and hopefully the government will listen to this and do something about it. Thank you for your concern, and we hope that it gets better going forward.